Hello, and we are Group A, and we're here to talk about Heart of the Community, tackling cardiometabolic health through pop-up care in Jefferson County. So chronic disease disparities, a substantial percentage, about 45% of the population, experiences higher rates of obesity, diabetes, and hypertension. So that's limited access to specialists drives preventable hospitalizations and exacerbates poor health outcomes. So our team decided to take a deeper look at Jefferson County, where we can find some of these patients in the population. So our data came from the Jefferson Regional's 2025 Health Needs Assessment, and this table shows the population breakdown of Jefferson County in comparison to the state of Arkansas. The data presents that 19.4% of residents are 65 and older versus the state average of 18%. 57.3% are non-Hispanic Black versus the state average of 15.3%, and the male and female percentages are in line with the state's percentages. The median household income is $49,600 compared to the state average of $58,700. And 24% of Jefferson County are people in poverty, compared to the state average of 16.2% and the national average of 12.3%. So here we're kind of looking at our clinical care. And so for the purpose of our project, we took a deeper look at avoided care due to cost. And in Arkansas, we ranked 43 out of 50. And for primary care providers in Arkansas, this is the number per 100,000 population. The state also ranks 43. And for an uninsured percentage of the population, Arkansas ranks 36. So here, the health needs assessment and our data drills down a little bit deeper to specifically Jefferson County. Here you can see that 8% of Jefferson County is uninsured, and healthcare providers' primary care physician ratio is 1,370 to 1. And some health statistics that could be attributes to chronic disease and heart disease would be the adult smoking percentage at 24% compared to Arkansas 20%, and some of the US top performing counties at 23%. Adult obesity percentage is at a 45% and physical inactivity at 35%. So some key challenges in rural healthcare that were also discussed within this health needs assessment would be behavioral health crisis, aging population and their needs, healthcare workforce shortage, rural hospital stability, and health infrastructure and access barriers. So part of that chronic disease management is that rural populations experience higher rates of chronic disease, such as diabetes, heart disease, and obesity. And it's often due to limited access to preventative care, healthy food options, and fitness resources. Healthcare providers must implement community-based chronic disease management programs, integrate patient education, and expand access to specialty care to help patients manage and prevent long-term complications.
Now that Megan has talked about the healthcare disparities that are in Jefferson County, I wanted to take a moment and look at what healthcare already exists in the county. I kind of broke this down into three categories. There's Jefferson Regional, the healthcare system that takes care of most of the county. There are a few independent clinics that I grouped together into this independent care category. And then there are other health systems that have a little bit of a presence in the county. Jefferson Regional is a community nonprofit hospital that is located in Pine Bluff. It is licensed for 290 beds, but right now its average daily census is about 100. They are a level 3 trauma center, and they do feature a family medicine residency program for MD and DOs from that's like built in partnership with UAMS. I've listed here the specialties that are available at Jefferson Regional, but of note, they are lacking in GI, neurosurgery, and cardiothoracic surgery. Recently, Jefferson Regional decided to build a specialty hospital that's located in Whitehall, which is also in Jefferson County. What they did is they took their psychiatric unit and their inpatient rehab units and they moved them into this state-of-the-art new facility. It is 76 beds split, 40 beds for inpatient rehab and 36 beds for the inpatient psychiatric ward. It opened in June of 2024, but it currently is not operating at full capacity. Part of this is just the nature of a new hospital operation. Part of this is some insurance problems with just this being the first dual facility of its kind in the nation. But of note, the psychiatric facility, once it is fully operational, will feature both inpatient and outpatient services that are available as kind of a step down unit for patients of all mental health varieties. Um, in the independent care section, I kind of grouped together multiple primary care clinics that are still independently run. Some of them are even run by families or generational physicians. Some of them are slowly joining into the Jefferson Regional Health System, but some of them are still independently run and are taking care of some of the more rural areas in the county, like Redfield or some of the other smaller towns. There are a couple standalone urgent care facilities in Whitehall and in Pine Bluff. Then there are a few dialysis clinics, and then there are several skilled nursing facilities or nursing homes that are spread throughout the county. This last section is just a small representation of the healthcare system in the Jefferson County, but there are other health systems that have a presence in the county. Baptist Health has a couple clinics that are in Pine Bluff. The VA has a clinic that's in Pine Bluff. The UMS, in addition to their family medicine practice, they also have a couple clinics that are in the county. And then Arkansas Children's Hospital also has a children's clinic that is available in the county.
So, our public health plan is to address the high level of cardiometabolic conditions among populations in Jefferson County, and we will do this through pop-up clinics. According to you et al. In their journal article, pop-up clinics are actually a great way to reach vulnerable populations that have limited access to healthcare, and it's basically delivering it to their doorstep, which makes it very convenient and it also helps eliminate the geographic limitations that some people come to because they lack a reliable source of transportation, so they can't make it to doctor's appointments. And eliminating the geographic limitation will help eliminate or decrease the amount of appointments that they might miss and miss something that they could have caught earlier, and then also help reduce costs because pop-up clinics are generally free, if not very low cost, and they can go to these pop-up clinics without the anxiety of having high bills to pay and not afford their care. And this just helps increase the preventative measures that we want to take with our community and keep everyone healthy. Some of the services that we would be able to provide in our pop-up clinics would be blood pressure checks to see if they have hypertension, or blood glucose testing to see if they're pre-diabetic or diabetic, cholesterol and lipid panels, EKGs to see if their heart is regular, or if anything might be going on with that. BMI and waist circumference to see if they might be obese, and then also mental health assessments, just because there is such a high level of behavioral health concerns in Jefferson County, that we could assess our patients and see if they might need more services for that. We would implement this and in three different phases. The first phase would be weekly pop-ups for a month or so, just depending on the volume of patients that we would receive. And this is kind of like our way of getting out to the community and getting the word to be spread about it. And then phase two would be bi-weekly pop-ups, just to kind of uh, continue to meet the more frequent needs of patients. And then after a few months, we would go into phase three and maintain a monthly presence in the community just so they have a consistent presence of healthcare providers in their community. Um, and then afterwards, with aftercare, it's important that after patients might find out results of their screenings or tests, that we can refer them to PCPs if there is something more concerning there. Also, caseworkers that can help them navigate what their new life might look like after receiving a diagnosis. And also just to help them live a healthier life if they would like. And then also set up telehealth appointments so they can follow up with their doctors. We would also provide transportation to follow-up appointments just because of that geographic limitation. We want to be able to make sure our patients can go to these follow-up appointments and continue to see their doctors regularly. And this will help strengthen the relationship within the community healthcare workers, just because our pop-up clinics will go to places like churches, schools, farmers markets, places that people in the community are already going anyways, and so they can be there for their care.
So our plan to engage our stakeholders for our pop-up clinics would be first to identify who our key stakeholders are. That would be community organizations like churches, senior centers, schools, local businesses, community members like residents, particularly those with chronic conditions, and caregivers, patient advocacy groups, and also healthcare organizations like Jefferson Regional Medical Center, UAMS Medical Center, pharmacies, and behavioral health providers. From then, we can form a community advisory board, and the purpose for that would be to ensure that the community voices help guide the program design, implementation, and the sustainability. We can recruit 10 or 15 members to represent faith leaders, clinics, public housing members, patients with those diseases, and local business leaders. And we can hold monthly board meetings to identify pop-up clinic locations, times. We can review outreach strategies and monitor our program effectiveness. We can organize listening sessions to build trust within the community and ensure the program meets real community needs. And we can use short surveys and focus groups for that. We'll engage faith and community leaders because the faith leaders in Pine Bluff hold a lot of influence in the area, and they can help us increase participation. And we can meet with them to explain the program, and we can ask them to help host pop-ups and help promote the events. We'll recruit and train community healthcare workers, and that will help build trust and improve our program outreach. And we can hire them from neighborhoods where the clinics will actually operate and train them in cardiometabolic health basics, care navigation, telehealth setup, and even HIPAA regulations. And then they can conduct home visits and do community outreach and follow up with our patients. And we'll want to develop partnerships with local organizations and have formal MOUs with Jefferson Regional and UAMS for referrals and lab work and follow-ups for our patients, and partnerships with local pharmacies for medication pickup and counseling on those medications, and also partnerships with food banks, SNAP programs, and fitness centers. And we will do a lot of communication and outreach, and we're going to use a lot of different channels to get our program out there. We're going to use flyers at churches, radio spots, social media, and we'll share success stories and testimonials from our early participants. And we'll make sure that all of our materials are culturally appropriate for the area. And lastly, we'll have feedback and continuous engagement and collect participant feedback with surveys or suggestion boxes in clinics and churches. And we'll review the data with our board members, and data would be like clinic attendance, the rate of follow-ups, and some health outcomes. And then we'll make adjustments based on that feedback, and we can publicly report our program improvements.